Do you know someone who suffers from a chronic illness? What is their life really like? In the US, it is estimated that 133 million people, nearly half the population, suffer from at least one chronic illness. Chronic illness, according to the Center for Disease Control, is a condition that lasts 1 year or more and requires ongoing medical attention or limits activities of daily living or both. People with chronic illness are at risk for poor health outcomes and consume more healthcare dollars than people who are well. Having a chronic illness can bring on heavy financial burdens from multiple medical bills. But what happens when a person with a chronic illness loses their job or source of income due to physical and emotional deterioration? In the US, it is estimated that 25 million people are disabled by their illness. When physical and emotional deterioration leads to loss of paid employment, a person with a chronic illness has difficulty coping. Loss of income means a loss to conduct normal life. The burden of the chronically ill does not lie upon and remain within the ill person, but within his or her whole family as well. Therefore, the entire household ends up becoming indirect victims. The financial hardship tends to push households from comfortable living or a secure life towards the probability of becoming poor. The chronically ill person can experience feelings such as being a burden to the family, feeling alone, and seek isolation due to the loss of their role as a provider. They can also experience demoralization, which is a syndrome of existential distress that can emerge from living with persistent bodily symptoms. Studies demonstrate the significance of demoralization and its association with physical symptoms. When physical symptoms become chronic and difficult to treat, individuals may become demoralized due to loss of integrity, which challenges the performance of their social roles, capacity to feel pleasure, and the sense of competence and morale. Family members must be prepared to deal with feelings of guilt, frustration, anger, and depression, and others accompanying this responsibility beyond the huge variety of feelings experienced by the patient. Another loss as a result of losing income is the loss of a positive social identity. People living with a chronic condition not only suffer an illness burden, but a social burden. Social isolation appears to be more detrimental to overall well-being than it is their ill health. Research shows that the effects of health relating to income is small, whereas the indirect effect through social relationships is substantial. Being chronically ill is not a one-moment stressful life event, but a continuous process of balancing the demands of illness and the demands of everyday life. Healthcare providers should actively address the individual social circumstances of people with chronic illness and the broader context in which self-management of chronically ill people take place. Research supports the need for early intervention following the diagnosis of a chronic disease to prevent productivity losses. People have more difficulty coping with chronically ill symptoms in the early stages of diagnosis, which impact work productivity. More research is needed on how employers can effectively support their employees with chronic illness. Complex care management programs is an innovative approach to improving outcomes for people with complex medical issues, but more research needs to be conducted to understand its full potential. People with chronic illness don't choose this life, so let's help them.